I just wanted to say thank you to Mrs. Edwards. You were at University of New Hampshire, and she spoke with my sister. I was in the recovery room having a double mastectomy, and she gave my sister gave her the phone, and she gave me encouragement over the phone, someone she had never met before, and I wanted to say thank you. I have just finished 8 months of chemotherapy and radiation. I'm a single parent of 4 teenagers, putting 4 children through college right now, plus myself. My husband walked out on us 3 years ago. And I have had to borrow over $50,000 out of my 401k to survive and to pay for my medical bills. And I have Blue Cross and Blue Shield. I'm from Lincoln, Nebraska. And I just want you to do something about health care and fix it, please, without compromising health care, because that's why I'm alive today.
Thank you. Thank you very much. I'm going to thank you very much. God bless you. I'm going to let, Elizabeth's going to want to say something too when I'm finished. She's going to come around and hug you probably now. Thank you very much. You are the reason I'm running for President of the United States. People want to know why you're running. You are a living, breathing example of why I'm running for president. In the richest nation on the planet, to have anybody have to go through what you've gone through and worried about where you're going to get the money for the health care that you need. How can that be? I mean, and the children's college, thank you. And the children's college is just wrong. And I will tell you, I hear your story. It's so moving and touching to me personally. And I'm going to tell you, you know, I know I'm not. It outrages me. It makes me angry because I know why you don't have what you're entitled to. The reason you don't have it. When are we finally going to have somebody that stands up to these drug companies and insurance companies that are running this country? I mean, sooner or later, somebody's going to have to fight them. Somebody's going to have to take them on so that you don't have to go, you and your sisters just like you. I mean, we're lucky. I mean, people always look at us and say, oh, you're so brave, you're so strong. The truth is, Elizabeth and I are very lucky because first of all, we've had extraordinary support from people, and we have the best health care you can have. But there are millions of people who don't fall in that category, and I've heard Elizabeth, she's more eloquent about this than me, but if you don't have health care coverage and you develop breast cancer, what is it, Elizabeth, 30 to 50%? 30 to 50% more likely to die if you don't have health care coverage. It's unbelievable. And we have to do something about this. I will tell you, first of all, I'm going to remember your face, and I'm going to remember your story and what you've gone through. And thank you for what you said about the woman I love. That means a lot to me. But I will not forget this, and I promise you, I can't promise you what will get done, but I can promise you I will, with every fiber of my being, fight for health care for you and every other person in this country. Give me just a second. Let me let Elizabeth say something.
I want every one of you to also keep that story in mind. And though she may be from Nebraska, that story is repeated in this state more times than you want to know. 127,000 people in the state of New Hampshire have no health insurance. You need to go to every candidate and ask them a question. If you have a health care policy, certainly hope you do, how many people in the state of New Hampshire will be uninsured when your health care policy is enacted? And if that number is not 0, she could be left out. There's no excuse for her being left out. Ask every one of them, is your number 0? If it's not 0, find yourself another candidate.